Welcome to the Just for the Health of It podcast, interviews with local health experts, hosted by Warren County Public Health. I'm your host, Drew Crawford, public health educator here at Warren County Public Health. Today, we're excited to talk with Vicky Yata, I believe, correct? Is that the right way to say your last name?
It was close. It's Yata, but that's good.
Yata, okay. So we're here with Vicky and Mary Beth from the Cancer Services Program from Glens Falls Hospital, the Charles R. Wood Cancer Center. The Cancer Services Program, fantastic program. You guys are offering free cancer screenings for people that are within New York, people who may be insured but don't quite have the insurance enough, or you guys are offering a lot of good programs here. And with October being Breast Cancer Awareness Month, that's what our topic is going to be. So before we begin, Vicky, Mary Beth, if you guys wouldn't mind just sharing a little bit about yourself, things that you guys may enjoy, how you got into the position, why you got into the position, things along those lines.
All right. Well, I'll go first. Like Drew said, I'm Vicky Yata. I'm an oncology nurse at the CR Wood Cancer Center at Glens Falls Hospital. I've been an oncology nurse for 18 years and went right into, oncology nursing right from nursing school. Because my aunt had liver cancer and I helped her through her journey. And I said, if I could do it for my family, I can do it for everybody else. And I haven't looked back since. So a little bit about me, married to adult children, have a love of knitting, reading, and hiking. So there you go. That's all you need to know about me.
There we go. And Mary Beth?
I'm Mary Beth Fisher. I'm the coordinator for the program of the Cancer Services Program. I've been here at the hospital for 3 years. I got into the position through Vicky and just our connection with, we both love to knit. So through our connection of knitting and talking and this position opened up and it was just the right fit for me. So I came on board and it's been a great journey for the last 3 years. So I'm excited to see what's going to be happening in the future.
Well, that's fantastic to hear. And like we said, you guys with the Cancer Services Program, you guys really are just a really big piece of our community and a really big piece with our aging population. As we know that as we age, chronic diseases become more and more common. You're at much higher risk. And with that, we definitely see it in our county. Our average age in the county, I think, is it's much higher than the national average, but with it, our cancer rates kind of follow that. We do have a really high smoking population. So breast cancer, cancers of all sorts and types, they're very common here. With us, we have an incidence rate. We get a lot of data, but if I'm being honest, the data isn't fun to read. So that's kind of the whole purpose of talking to you guys. We get incidence rates where our female breast cancer cases was 226.6 per 100,000 females. Now, what that means, I couldn't tell you. But, with you guys being at the forefront here, being in the community and talking to these people, and, you guys are seeing these patients on a day-to-day basis. So talking to you guys is going to be really beneficial for, I think, everybody. And with that, what have you guys really seen with the breast cancer in general in our community? Cancer is obviously a really big piece, but how about breast cancer? Have you guys seen an increase in cases? Is the national data kind of following our community? What do you guys see?
So I'll take this one. So, I do track a lot of the breast cancers that come in because as an oncology nurse navigator overseeing our navigation program, all of the patients who are diagnosed with a cancer, specifically breast cancer, get to meet one of the navigators and kind of help follow them through the path. So part of what we do is we have to report numbers to our cancer committee, and then we use the New York State data. So what we have seen is exactly what you said. In our area, we're seeing an increase in the number of breast cancer cases that are diagnosed. But what you don't see from that data is at what stage are they diagnosed. So, stages go from stage 0, which is considered that pre-cancer, right up to stage 4, which is a later stage cancer, still treatable. People can live a long time with a stage 4 diagnosis. Mm-hmm. But what the New York State data shows in our area, we have a higher rate of the number of people who are screened and have early stage where it's curable cancers, that stage 0 and stage 1. we have one of the highest rates of early stage cancers across New York State. So it may look like we have a lot of cancers, but we have a really robust screening program that are finding cancers early before they become a problem. And part of that is due to our cancer services program.
So
So
we're
while we're
able
on-
to,
Oh, I'm
we're
sorry.
able to reach out to people, to women in general who have not been screened before. And we screen from the ages of 40 to 64 within our program. And these women have shied away from getting mammograms or getting screened because they don't have the insurance to be able to cover the cost of these. And with able to stepping in, cover the cost of their screenings and helping them through every process or every step of the way, whether it's they've had a mammogram and they don't need to have any follow-up and they just need a yearly mammogram. We do that with them. We follow up, we remind them of their mammograms yearly. Or the person that needs that additional imaging, whether they need another mammogram or an ultrasound or a biopsy, we're able to cover all the costs of that. So we take that worry away from anybody so that they can just concentrate, okay, I need to get screened. I know I have a problem. I want to get this taken care of. So we can take that financial portion of it off of their minds then. And if somebody was to be diagnosed with breast cancer through our program, we're able to sign them up for a Medicaid cancer treatment program. Covers everything, soup to nuts. As long as they are in treatment, they are covered 100% without any cost to themselves.
And I mean, that's fantastic to hear. You know, Vicky, as you were saying, with the whole breakdown of the data, that's something that we don't see an awful lot of, which is definitely something that we would love to see a little bit more of. But you know, that's really important to point out is that the screening process is really is really important for not just breast cancer, but it's important for colorectal cancer. It's important for oral cancer. It's important for all different types of cancers. And, you know, breast cancer is just one of the many where screening can kind of benefit. And, you know, while we're on the cancer services program, if you guys wouldn't mind going into a little bit more in depth, what does the cancer services program kind of offer for a community member?
Sure. So if a community member is between the ages of 40 to 64 for female, 45 to 64 for male, and they don't have insurance and they need colorectal, cervical, or breast screenings, we're able to help them with that and cover them 100% on their screenings. We work with individuals that with no history of colorectal cancer in their family, they can maybe possibly do a FIT kit, which is an at-home colorectal test. Kind of takes the fear of the colonoscopy away and they still get their screening done. With cervical, we are big proponents of, you know, you get your mammogram, or I'm sorry, you get your pap and your pelvic and HPV testing done. And depending on how your outcome is, we're able to follow you through whether you have a yearly follow-up, 3-year follow-up, 5-year follow-up. With the colonoscopies, again, we follow individuals, whether, you know, when they have a colonoscopy, it's either 3, 5, 7, or 10-year follow-up. We keep these people in our records. We call them up, remind them it's time for getting their screening. So we're able to help those individuals that are under the age and women who are under the age of 40, but are finding issues with their breasts, whether they've felt something's changed in their breast and the way it looks. We're also able to help them. And we get them into the doctor to get their screening done to see if any diagnostic testing needs to be done. And with a form that the doctor fills out, we're able to submit that to the Department of Health and they'll cover the cost of their diagnostic testings or anything that they may need. And we've had quite a few individuals that have come through our program in the last year that are under the age. And you know, if anybody's seen this and they have felt something and it's not normal and they're afraid to go get it, just give us a call. We can help them out.
Mm-hmm. And I mean, that's fantastic to hear. The cancer services program that we have at the CR Wood Center is one of the most robust in the state. And really, like the screening process is saving hundreds of lives genuinely from our community. We have a much older population, as we said. And with that, what kind of barriers do you guys see with providing these services to individuals? Is there barriers from a policy standpoint? Are there barriers from a social kind of attitude standpoint? What kind of barriers do you guys see that prevent you from impacting the community in the most way that you can?
For me, what I see when we do our outreach and such is the social economic, problems, as far as people being afraid to not have that insurance and the money to be able to get any of this done, and trying to let them know that they don't have to have that money. So we can cover them. Also, it's an interesting, how much information, what kind of process is it? It's seriously a 2-minute phone call of calling us. We get your name, address, phone number, a little bit of background information, and then that's all we need, and we can help cover anything you need. I don't need your W-2s, I don't need your bank statements, none of that for these screenings or these diagnostic testing. So it's just getting people back involved into the healthcare system, re-engaging them into, because a lot of these people who have not had their screenings aren't engaging with their healthcare providers. So they're not going for their yearly checkups because they don't have that ability to do this. And we're able to help them get back into the healthcare system. So
Absolutely. And Vicky, while we can, somebody who may receive a cancer diagnosis, there's a lot of things that go through their head. It's a huge diagnosis, and it can be terrifying at times. So Vicky, how do you kind of navigate that question or kind of navigate that conversation where, like, yes, you received this diagnosis, but here's what you need to focus on right now. This is what your process needs to be in the time when you can.
So each person is a unique individual. So everybody's fears and worries are totally different. So that's the role of the navigator that meets with them to kind of say, what is first and foremost for you that you are afraid of? What can I help you first? So a lot of things that we do is, just like you said, those barrier assessments. Do you have issues with transportation? And if they do, we find transportation resources. If they're worried about losing their job because they now have to go through surgeries and treatments and that kind of stuff, we work with them to get the paperwork they need to get their provider covered. Financial issues are a huge thing for people, because if they can't work, then they lose that income. Or, if they do have insurance, if they don't have the Medicaid Cancer Treatment Act, a lot of insurances have high copays and deductibles. So we help work with patients to kind of decrease that financial toxicity that can happen with chemotherapy. And, one of the biggest things, like you said, is fear of the diagnosis. Cancer's scary. You hear that word and it's not always a good thing. I mean, it's never a good thing. Cancer is not a good thing. But, for us to say, we've got you, we know what we're doing here. We've got you. So trust that we're going to get you through this process quickly. You're in great hands. We have medical oncologists here that are experts in their field. We have radiation oncology here that's experts in their field. We have surgery right here. So we are truly a multidisciplinary cancer center that offers all the great medical science behind how to treat cancer. But what people don't really know is we have all of these great support services. Like I said, I'm just one of 3 nurse navigators. We have a health psychologist and a mental health counselor that people can see. We have a boutique here that is free of charge for our patients. So if they have to go through chemotherapy and lose their hair, we can get them a free hat, wig, head covering, whatever they need. We also have massage and Reiki services right here for our cancer patients. And that's based on their income is how much they pay. Both of our therapists are oncology certified, so they know how to treat our patients. It's a great modality for reducing stress. We have nutritionists, we have geneticists, we have social workers, and we have a phenomenal group of nurses here that are very well trained in how to manage people's fears. So we're a very holistic cancer center. So we've got everybody covered from diagnosis right into survivorship.
And that's fantastic to hear. As we hopefully from a public health standpoint, and I'm sure from your guys' standpoint as well, you want everybody to screen. You want 100%, no doubt about it. Like, I know exactly what's going on. And I mean, that's ultimately, the end goal is everybody screens, everybody takes care of their health. And that's not always an option. It's not always going to happen. So from your guys' standpoint, what kind of stops people from going to get that screening? What kind of stops people from, saying, I would really like to know, but I'm kind of afraid of the answer. And that's how we are kind of seeing it. A lot of people are just afraid of the answer that they're going to get. But like I said, you guys have those conversations on a daily basis. So what do you see as, like, is it a lack of engagement? Is they feel like they're not supported as much? Is it the policies are too confusing, so I can't figure out how to navigate it? What is kind of the biggest barrier from everybody trying to get screened?
I think it's a little bit of everything. For me, that's what I see is I see the fear of going to the doctor, the fear of what they're going to tell them, the fear of what it's going to cost me to be able to get in there, the fear of, oh my gosh, I need to get financial aid from a hospital and all the forms and everything I need to fill out. And we can help them through every step of the way. And that's one thing when I'm dealing with our patients and I'm on a different end of it than Vicky is. I'm in the beginning. So we get them screened and then we get the diagnostics and if they need biopsies or anything. And they do get the, that they have cancer. I can say to them wholeheartedly, I am handing you off to an amazing group of individuals that are part of the cancer center that, that I can hand them over to Vicky and say, she's going to take care of you 100%. And any questions you have, if they can't get the answer, somebody can get you the answer. But just letting them know that more of a human side. It's not just statistics. It's not just forms. It's not just money, but there's a human side to this and that you will be cared for, taken care of, and people here truly do care for you.
And then I think the other thing that I see is that there's so much information out there and not all of it is succinct. Like I have people say, oh, I was screened and my doctor said I don't have to be screened for another 2 years because, my risk is really low. But, or I don't have family history, so I don't need to be screened as often. So my risk of breast cancer is really low. And what I say to people is just because you don't have a family history doesn't mean that you're at low risk of getting, you are at low risk of getting breast cancer. You're not as high risk, but only 15% of the population is a genetic link for breast cancer. The rest of it is sporadic. We don't know why it happens. So it's still important to have that risk stratification discussion with your doctor. If you have a primary care physician, say, here's my family history, how often should I be screened? But a lot of people are like, oh, I don't need to do it. That's okay. My doctor said it's every 2 years. I'm good. And that's, I think, one of the biggest issues is there's so much discrepancy in how often people should get screened.
Mm-hmm. Absolutely. So when we kind of talk about getting people to be screened, do you find that there are ways that we can further improve the amount of people that we get in, whether it's from a legal and policy standpoint, whether it's from a community engagement standpoint, or it's just getting your guys' name out there? What do you feel is going to be the most beneficial for you guys to get your name out there and really just hammer in on the community and get all those screenings out there?
I think it's all three. I don't know if Vicki agrees. I think it's all three: getting the name out there, getting education out there to individuals so that they understand the importance of the screenings. As Vicki said, most people say, well, nobody in my family has ever had cancer or breast cancer or anything like that. And so to tell them, that's not the case all the time, and to know your body, be tuned into what your body is telling you. If you feel a lump or something has changed, the nipple's inverted, something looks different, you've got, a dimpling on your skin, you get it checked out, and don't be afraid to do that, because science has changed so much, and Vicki will be able to tell you more about that as far as the treatments that are available to patients now that are screened and diagnosed early is amazing. Amazing to see some of these patients that have come in, what they've gone through, and then they're cancer free for 5 months or 5 years, 10 years, because there's so much that's going on. but it's just getting people to not be afraid. And get the screening done. It's 15 minutes of your time, of your day, and you can walk away feeling, okay, I did something for myself. And I know there's always that baseline that you can work on then, and look at that from year to year and see how you're doing. So
I would say the policy piece is really low on the totem pole, because I think most providers or most employers have a policy that, a wellness policy that, sometimes they actually pay their employees to go get their annual screening. So, I think that policy piece is actually pretty good. And of all the cancers and cancer screenings, breast cancer is the one that's been talked about for a million years, it feels like. I think everybody knows the importance of breast cancer screening. So I think the policy work is pretty good. I think community engagement is, next on from the bottom list, but I think letting people know about CSP and the program that they have is one of the biggest pieces that I think our community is still not aware about. I always joke with people that say they don't realize what a great cancer center we have here right in Glens Falls, but they don't know they need us until they need us. So they're not paying attention to the cancer center or the cancer services program until either one of their loved ones gets diagnosed, or their friend gets diagnosed, or they have a breast cancer scare. And then they're like, oh my gosh, that process was so smooth and easy. The nurses in the breast center were compassionate and caring, and they followed up to make sure I was okay. And, if I was diagnosed, they hand me off to a navigator that everything's covered and I got through quickly. And, people don't realize that that's what happens here. But they don't know they need us until they need us.
Yeah, absolutely. And, as we're, kind of on the topic of what things that we can always improve upon, is there anything new and exciting from your program that you guys are willing to kind of put out there and say, you guys should definitely come in? We just got, like some new nurses, or we just got brand new equipment, or, we're really excited about, I don't know, anything going on. Is there anything brand new going on with you guys?
Mary Beth, anything from your end?
From our end, no, not really. We are pretty solid with what we're doing.
Yeah, absolutely. And I mean, it's always good to just to double check, just, make sure you're, talk to you guys, see what's new and what's going on. Kind of being I'm sorry?
Oh, no, let me tell you a little bit. Our breast center has two, what they call tomosynthesis machines. That's for the mammogram. So, old digital machines are, they're a 2D machine. And a few years ago, we got one, what they call a tomosynthesis machine. Now with that, we were able to see breast cancers at such a smaller rate. And the analogy that I like from the breast center that they tell me is the old mammograms was like taking a book and you squish the book, right? And you look at the mammogram and you're trying to look through the cover of that book and find all those little cancers within there. So with this tomosynthesis machine, it's like opening up the book and you're able to see every page within there, because that tomo machine goes all over your breast. So they're able to see smaller cancers, or if it truly is a cancer, they're able to see that earlier. So reduces that callback, reduces the fear. So we actually have two of those tomosynthesis machines right here at the Glens Falls Hospital.
Wow, that's incredible to hear. Obviously I'm not going to try to repeat back the word, because that wouldn't go well at all.
So just say 3D breast imaging.
3D
That's
breast
yeah, there we go.
And the technicians at the breast center are amazing. You can't be afraid to go in there. It's, the women hear the stories of, oh my gosh, it hurts, and they squeeze you and all this other stuff. And with the 3D imaging machine, it has changed. And you see, I didn't even try to say that word. Has changed everything so much so that it's, it hurt last time. Well, it's not going to hurt. It's uncomfortable. You're not going to want to walk around with the mammogram attached to you all the time, machine attached to you, but it's not as bad as it has been. It's improved a lot. Our technicians are amazing. They're quick. They're sympathetic. It's a great group down there, and you can't be afraid. Just do it.
Absolutely. I'm sorry.
they do have evening hours, so don't use like time of day as
Right.
a barrier to get into treatment. So they fit everybody's schedule. So they do have evening hours for those people who work Monday through Friday, 9 to 5, and it's hard for them to take time off. They can
Mhm.
schedule evening hours.
Absolutely. And, I think obviously the cancer services program and just the cancer center in general is very robust. It's something that we always look forward to, and we always try to promote you guys in any way that we can because of the things that you guys are capable of doing and the things that you guys have done for our community. And, as we were talking about, navigating that conversation of from diagnosis to what next steps, what kind of tips or advice would you have for somebody who didn't receive the diagnosis, but is very close to a person who would receive that diagnosis? What kind of tips, words, or advice would you give to somebody that's kind of being there very close to that situation?
So from my standpoint, anybody who's diagnosed with cancer who has a close family friend that knows about it. So take your cues from the person who was diagnosed. If they want to talk about it, they'll let you know. Be there to support them, but keep things as normal as possible because their world is going to go upside down in a matter of weeks. So try to keep things as normal as possible. Ask them what they need. Don't just assume that they want you to come over and vacuum their house. I mean, I'd like that and I don't have cancer. So, but just ask that person what they need and just kind of be there for them.
Mhm. Absolutely. And, like I said, you guys have really been kind of the forefront for our community as far as just in all actuality, really just a beacon of light, really, for somebody who may be going through this diagnosis and may feel like they're not being supported. Which, speaking of support, you guys have support groups. And if you guys wanted to talk a little bit about that, what the support groups really are, what it really entails, and what kind of topics or conversations kind of go on from there.
Sure. I mean, through COVID, we actually had to move a lot of our support groups online, so it wasn't as well attended. But traditionally, we do have an after breast cancer support group that meets the fourth Monday of every month. We are going to try to get those back in person. I also have a metastatic breast cancer support group that has been, they meet every third Friday. We do an online session, basically, that we're going to try to get back in person. So the great thing about a support group is you're connecting with other like individuals. So people who have had similar experiences to you, because your friends and family, they don't know unless they've gone through a cancer diagnosis. They have no idea how you feel. So the greatest part of the support group is having that sisterhood of people who understand what your concerns are, what your feelers are. And, that's what a lot of the group is. We talk about fear of recurrence if they've gone through treatment, or fear of treatment, or how do I talk to my loved one about this, and how do I be upset without making everybody nervous? That's one of the biggest things. So I use my guide from my people who are at the group as to what at that time is most important to them, and we make those discussions happen.
Absolutely.
I want to do a little shout out though too. Breast cancer isn't only a cancer that affects women. Men are also, and men also go. We've covered men with mammograms. So, men, if you've gotten where you felt something's abnormal, go get screened. It's not abnormal for you to have, to have this done, but men also can get diagnosed with breast cancer, and that's not really well known or spoken about either.
Absolutely. I always feel that when it comes to cancer, the amount of research and new information that comes out makes it very hard to keep up on it. So, from somebody who isn't medically inclined or, isn't involved as much, it's really hard to kind of know everything you need to know about it. And from your guys' standpoint, you guys have to stand there and be the know all be all and, say, absolutely, like, we've done this before. I know what it is, all these different things. Do you feel that the amount of new and, frankly, exciting from my standpoint, because I love to read those things, but, the new and exciting breakthroughs and information that's coming out, do you find that can kind of lead as a barrier where, younger generations are learning more and older generations are not learning nearly as much new information?
That's an interesting question.
Mhm.
So, I think you need to get that age thing out of there, because I have some younger patients who are like, I don't want to know. Don't tell me anything. Just tell me where to go and what I need to do. Don't tell me all the details.
Mhm.
And then I have some, older people in any age range that are that consume those information consumers. They get online and they read everything that they want to, they need to read. And, sometimes it's too much and sometimes it doesn't apply to their diagnosis, because there are, if we want to talk about breast cancer, because that's what we're talking about, there are 15 different types of breast cancer. And within those types, there are subtypes. So they're all treated just a little bit different. So, there's so much research that are coming out that are finding new things to help people, reduce the risk of recurrence of a breast cancer. Or if they do have a chronic cancer, what are we doing to kind of make them stay healthy and alive longer? So I geek out on a lot of this stuff. So I'm like, this is an exciting time. If you have to have cancer, now's the time to have it, because there's so much information out there.
Mhm.
So,
Absolutely.
and I guess it's just having trust in your medical provider, trust that they know what's best for you and what is the latest research that's going to be the best decision for your specific type of cancer.
Yeah, I don't find like the age is a discrepancy at all in knowledge. I mean, I will have some young people that need to get further testing and they'll be like, nah, I'm gonna wait. Where you have other women who may be older are like on top of it. Okay, let's get this done. Let's see what's going to happen. And there's so much news coming out. Like every time you turn on the new, the TV channel, there's something. Don't drink coffee. Drink coffee. Don't, if you have questions, go to your provider. Ask the question to them. They're the professionals. They're the ones that can get the answers for you and have it not coming from your TV set. I mean, it's, I have questions every day for Vicky. She's my source. She's my knowledge. I'm like, I don't have a medical background either, but I'm like, okay, this is interesting. It looks good. What is this? And she'll explain it to me. And it's like, all right, that's good. That's not a bad thing. Okay. But if you have the questions you don't know, don't be afraid to pick up the phone and call
Mhm. And, while we're kind of on the topic of trusting your medical provider, your medical team, when you have a cancer diagnosis, becomes, really your rock during the whole time. And so, kind of opening up and learning to trust these people that are doing all these tests and, doing all these different things to you. How do you propose that somebody as a patient, really navigate that conversation of being like, hey, I really kind of want to trust you, but whether it starts as like organically just talking about, okay, what steps are there? Let's put it this way. I'm sorry. From my standpoint, I always have my mom in the doctor's office. My mom would speak for me 100%. When I, eventually had to grow out of that, it was a very hard conversation to have and talk and be open and honest with my doctor. How do you propose somebody does that from something, I get nervous doing it. It's during an annual physical. I can't imagine trying to do something like that during a cancer diagnosis. So how do you propose people kind of navigate that conversation and really build that patient and healthcare professional relationship?
That is a really hard thing for people to trust. There's some people that just blindly trust doctors, and which is great because they are the most knowledgeable about what you have going on. There's other people that come in with a million questions and I tell them, write it down, all those questions, because once you get in and the doctor starts talking, you're going to forget those questions. So write down your questions before you even come in to see the doctor. So that way you don't forget to ask. And one of the most important things that I want people to remember is the doctors in the medical community, they work for you, right? So you are in charge. So it is you as the patient that says, hey, I need you, doctor, to help me do X, Y, and Z. So really to let people, just to remind people that they truly are in charge. They are in the center of healthcare. So once you tell people that, they think, oh, you mean I'm not just on the outside and you guys are just telling me where to go? No, you are important. So we're going to give you our recommendations. We're going to ask you how we can help you. And then you're going to lead this journey with the support of all this medical staff.
Mm-hmm.
You're your own best advocate. And that's what you got to remember. It's you that you're taking care of yourself. So you have to be put yourself, which is hard for a lot of people to do, but in the forefront. You got to be number one for a while to take care of yourself, but be your own advocate. Don't be afraid. You can't be afraid of your doctor. You got to be able to say exactly how you feel. They're not going to be able to treat you if they don't understand where you're coming from or what concerns you have. If you're being quiet about it, it's not going to help them treat you either. I know Vicky's so compassionate when she works with her patients, and it's an ease of talking to her. But with doctors, sometimes they don't always feel that way with that doctor. So that's where Vicky helps out a lot, because she's with patients in the doctor's office with them, and she's able to bring things up for the patient that they might not feel comfortable about saying, but you got to be your own best advocate.
Absolutely. And, as we kind of wrap up our topic here, our discussion of breast cancer, was there anything that we didn't touch on or anything that you guys would like to add, just as kind of getting out there?
So I just want to make sure that people in the community know that we do have a genetics program. So that's a high risk program. We do have 2 genetics counselors. So if people do have a family history of any type of cancer, not just breast cancer, and they, want to know if they have a genetic mutation or a, breast cancer gene, talk to their primary care provider to say, hey, I'm really worried about this. Can you send a referral to our genetics counselors, and we'll get you in and talk to you about what your risk is. And if needed, we'll do some genetic testing for you. And if there's any mutations, we'll talk to you about how to manage that. So just know if people are interested in that, we've got that service right here for them as well.
Right.
Mine is our number, 518-926-6570. You got a question, you want to get screened and you don't have insurance, call us. It's all it takes is one phone call. We can hook you up with, if you don't have a doctor, we'll hook you with a primary care person. We'll get you the screenings that you need, and we can help you all along the way. Again, if we couldn't help you, we have resources that we can refer you to. So 518-926-6570. Got to put the plug.
All righty. Obviously, thank you guys so much for taking time out of your busy schedules to come and talk to me about breast cancer. Thank you guys so much for everything that you do. Vicki and Mary Beth, very good people, absolutely wonderful at the Cancer Services Program, very good people at the Charles Harwood Cancer Center. And, not only just these 2, but the entire staff there has been absolutely amazing. They've been so nice every time that I've come down there to go and visit. Always felt like a second home. You guys have been absolutely amazing. Thank you guys so much. And thank you guys for everything that you do for the community. I'm your host, Drew Crawford, public health educator at Warren County Public Health. Thank you so much for listening. Be safe, be healthy, and we'll see you back here next time.